Hey, welcome back.
Did you miss me while I was gone?
I did. I miss you between the meetings, Okay, we're ready to begin again. I hope everybody had a good lunch, and we're only 15 minutes behind our schedule. Is it? No, we're actually 25 minutes behind, but we're going to shorten the afternoon break. Thanks very much to our two panelists, one of whom looks suspiciously like somebody who's an ex officio. This panel is on medical countermeasures and diagnostics, and as was indicated earlier, we feel like diagnostics is an area that we haven't really much focused on or not enough, and we thought this would be a good opportunity to do it. So we have two great witnesses. The first, of formation familiar face, is Dr. George Post, who is an ex officio on our panel and been a great help to us, chief scientist at Complex Adaptive Systems Initiative and Regents Professor, the Dell E. Webb Chair of Health Innovation, and former director of the Biodesign Institute at Arizona State University. A lot more I could add to that, but a real authority in the field, and we're really delighted that we're going to hear from him in this capacity today. And Dr. Jeffrey Ling, MD, PhD, Chief Executive Officer of SunQ LLC, Professor of Neurology and attending physician, neurocritical care at Johns Hopkins Hospital, founding director of the Biological Technologies Office at DARPA at the Department of Defense. Really, there's a lot of expertise in front of us. So thanks for being here. And Dr. Post, we'd love to hear from you now.
Thank you, Mr. Chairman. Recommendation number 30 from the Blue Ribbon Panel report in 2015 and Section 351 of the recently released U.S. National Biodefense Strategy, as well as many other reports, identify the importance of diagnostic tests across the entire bioincident response and recovery spectrum. These objectives, while cogent, reflect the obvious but all too often underemphasized and certainly underinvestigated principle that faster detection saves lives. History teaches us that the first clue that a bioincident is unfolding is likely to be when an unusual pattern of infectious disease suddenly appears in hospital emergency departments or on farms, and proficient mobilization of preparedness actions then depends on the speed and accuracy of diagnostic confirmation in these settings. Achieving this level of capacity depends on a number of critically interrelated elements. First of all, alert physicians and veterinarians identifying that an atypical event is occurring. Second, the assumption that a diagnostic test is available, which is not always the case. The availability of laboratory resources and trained personnel to conduct the test in a safe manner. And as we heard this morning, in an area in which diagnostic testing, at least in the G7 countries, will largely be based on genetic sequencing, by analogy with fingerprint testing, we need to identify and match the pathogen that's suspected against a large database of genetic fingerprints from pathogens around the world. The construction of these databases is far from straightforward and also requires substantial computational scale and sophisticated analytical expertise. And as we heard this morning, bioinformaticians and data scientists are in very short supply to undertake this exercise. Once definitive diagnosis has occurred, rapid mobilization then depends also on the existence of an information technology infrastructure to disseminate information quickly at a global, national, and local level. And the next generation of diagnostic tests, in addition to detecting the organism, should also be able to detect features indicative of drug or vaccine resistance, potential changes in virulence markers, and whether or not there has been deliberate engineering with nefarious intent. These seemingly straightforward requirements are in fact deceptively complex. Many aspects of the sophisticated R&D which is now needed to develop multiplex, multi-agent diagnostic testing are of comparable technology to drug development. but even if not breaching the $1 billion mark, nonetheless may involve sunk costs of anywhere between $100 and $200 million for the companies involved. And at the same time, I think it's interesting to note that the longitudinal prize initiated by the UK government just issued a report this week which documents the decline in investment in diagnostic technologies for infectious disease. As we heard this morning, the most important advance in infectious disease diagnostics in the last 5 years has been the shift away from culturing organisms to be able to identify them by their genetic signatures. This has the great advantage, it is organism agnostic. In short, any organism can be profiled. You can profile multiple pathogens and detect subtle changes as new variants emerge. But despite the transformative power of this sequencing, the cost and complexity of the technology still remain as barriers to routine adoption, including many US public health settings, yet alone in low-resource settings overseas. These barriers will undoubtedly fall with progress and transitioning to increasingly automated sequencing equipment, with the ultimate aim being portable handheld devices of this type for use in austere and low-resource settings. But in addition to the immediate and optimum management of initial cases, diagnostics are at the core of population triage to distinguish the infected from the uninfected. This is absolutely critical in prioritizing the allocation of finite medical countermeasure tools and in implementing relevant quarantine and other containment actions, all the more so in settings for which no drugs or vaccines are available. Effective diagnostic identification of non-infected individuals represents an invaluable community mitigation measure to reassure the worried well, who, particularly with media amplification, could all too easily overwhelm medical services and fuel public panic. Assuring the safety of imported food for human consumption has long been part of public health, but in the agricultural sector there is a growing recognition that animal viruses can survive in animal feed ingredients for substantial amounts of time. Most recently, in the context of the ongoing African swine fever outbreak in China, there's evidence that the virus can survive for at least 30 days in transoceanic passage. Another often overlooked importance of diagnostics is in monitoring the effectiveness of decontamination protocols to allow safe reoccupation of buildings, the disposal of infectious waste. Not exactly a cocktail party fact, but the average Ebola victim will actually generate something like 74 liters of waste to be managed. So you begin to amplify that as a waste disposal problem. Mortuary procedures, safe mortuary procedures, and disposal of infected animals and plants in agricultural bioincidents. Detailed diagnostics data on the genetics and other molecular features of pathogens are not only essential for containment activities, which I've just outlined, but if nefarious origin is suspected, then advanced molecular data will in fact be the principal evidentiary basis for forensic analysis and attribution. And it's important to remember, in the case of a major bioincident that extends over weeks or months, surge production of diagnostic tests will be vital. This is currently a major gap, with inadequate interagency coordination within government and insufficient market incentives for the engagement of the private sector, particularly in the case of very high complexity genetic and other molecular tests, and also to invest in the development of devices of this kind. But notwithstanding the primacy of diagnostics in the detection and management of an overt bioincident, innovation in diagnostics R&D is also crucial for building upstream biosurveillance capabilities. As we've heard, the goal of biosurveillance is to detect and limit threats at their source, to mitigate pandemic spread, identify zoonotic spillover from animals to humans, or avoid major dislocations in the agricultural economy and the global food chain. In the joint external evaluation exercise implemented under the international health regulations, the US scored predictably high in most dimensions of public health, but among the 8 lowest scores were diagnostics, and shortcomings were highlighted specifically to emphasize the need, I quote, to build surveillance systems for priority zoonotic diseases and pathogens, and to build animal and public health laboratory capacity to detect and characterize antimicrobial resistant pathogens. And as the panel has heard, this is the concept of One Health, the intimate linkage, not just on the basis of zoonotic disease, but broader issues of human health, animal health, and ecological health. We currently have an inventory of 1,400 human pathogens with 335 new emerging infectious diseases since 1940. Project PREDICT, the Global Virome Project, and the DARPA PREEMPT program have now identified over 1,000 viral species with the potential to be zoonotic risks, primarily coming from reservoirs in rodents, bats, and primates, and therefore targeting new biosurveillance capabilities to particular hotspots to monitor such spillover is particularly critical. The next element is the fact that development of such a real-time biosurveillance capability depends also on parallel proficiencies for the timely transport, receipt, and diagnostic testing of samplings, together with sharing of data to construct global databases and real-time situational awareness. I will not be as diplomatic as Admiral Shukat earlier. I think the recent action by the People's Republic of China to not share the influenza H7N9 strains is a troubling portent involving the one pathogen that most of us feel is potentially the most dangerous potential pandemic threat. And these unfortunate actions build on previous obfuscations and lack of transparency by the People's Republic of China about SARS in 2002 and the prevalence of circulating influenza strains in their poultry industry, and as I mentioned earlier, now African swine fever. And more recently, concern has been voiced that the Nagoya Protocol of the Convention on Biological Diversity may impose additional costs and delays in sharing samples because the gene sequences involved may be the potential source for filing of intellectual property by the nations involved. So data sharing, interoperable databases, and the big data challenge all come together, and despite the obvious theoretical appeal of real-time sharing of critical public health data, significant obstacles remain. We may, in fact, get data from 2.6 million people in emergency rooms per day, but that is often delayed in its reporting. It is voluntary, as we heard, and certainly does not capture the increasing importance of walk-in clinics such as urgent care and so forth. Even with optimum capture of data, data silo in multiple databases with incompatible formats and lack of interoperability still remains a major issue. And as we heard, the big data challenge moving to the exabyte world, namely 10 to the 21 bytes, is in fact an issue that we have to be ready for. So in summary, even though this is clearly a very superficial analysis of a very complex domain, with apologies for the alliteration, my remarks can be summarized by a series of S's. The first, by definition, is situational awareness. That is prime in all of these issues, whether it be biosurveillance all the way to forensic attribution. The second is surveillance. What's out there? What's potentially coming? The next one is speed to detect, to have turnaround times of less than an hour. The spectrum, the ability to profile across a broad range of organisms. Sequencing, gene sequencing, both at point of care and point of need. Simplicity at another level, particularly in the developing world where we would like to have remote handheld detectors. In any instance, scale and scalability, not only for our databases, but also in terms of surge production, which is a major gap and a major vulnerability, even if we know what the organism is in the case of an extended episode. Security of our databases will become increasingly important in an era of synthetic biology, in which one wants to make sure that data on new variants of serious pathogens cannot in fact be quickly exported. But my final S is perhaps the most important one, suboptimal. We have an underappreciation of the role of diagnostics across the full spectrum of biodefense preparedness. We underinvest relative to drugs and vaccine countermeasures. We have ill-defined priorities for interagency R&D and engagement of the private sector, underinvestment in the infrastructure and technologies to monitor the threat posed by zoonotic spillover, and lack of international policy development for dual-use applications of synthetic biology, which carry implications not only for the need for new diagnostic technologies, but also drug and vaccine development. So as acknowledged, Mr. Chairman, there are indeed a broad repertoire of new technologies which can be mobilized. These will in turn require new regulatory paradigms for these technologies, but perhaps the 800-pound gorilla in the room, apart from the pace of science and the changes that Mother Nature, yet alone terrorism, may impose, is that we have to create suitable market incentives for industry engagement, and for the most part they are lacking. That is a challenge not just in the infectious disease area. For those of us who work in the oncology field, reimbursement for molecular diagnostics for cancer is equally as pernicious as a problem. I'd be happy to address these topics and others in question time, Mr. Chairman. That concludes my remarks.
Thanks very much, Doctor. I'm going to add an S, which is a simplistic, or some might say simple-minded question, but just so I, for one, understand, what would you include in the definition of diagnostics, just as a general definition?
Anything that detects the organism, so that can be a lab-based test, it can be a wearable sensor, it can be a dipstick test, anything, in short, that enables you to detect that an organism is present. Right. Ideally, you would like to know additional features, but it's that trinity of classical laboratory diagnostics, right, increasingly wearable sensors or mobile sensors in devices, and you could even argue that elements of digital diagnostics are beginning to emerge through internet biosurveillance capabilities in terms of syndromics. So anything that enables you to better understand what an organism is, where it is, and what's happening with it. So it's a very broad definition.
And that can be in response to obviously an infectious disease outbreak, but also a bioterrorist attack.
Yes, absolutely. So all three categories of detection, whether it be upstream in terms of environmental biosurveillance, monitoring an event has actually occurred, and as I said earlier, once an event has occurred, the triage of the population, particularly to differentiate the worried well, who will be still the majority, from the infected individuals, and obviously in the context of veterinary medicine, distinguishing the infected herd from the uninfected herd or flock becomes equally important.
Great, thank you. I should have said first that when at college they had a special track for people like me in satisfying liberal arts requirements, which was called Science for Non-Science Majors. So thank you, I understood. And Dr. Ling, thanks for being here.
Thank you, Senator.
Thank you for all your service.
Oh, absolutely, Senator. It was my honor and privilege. It is really my honor to address you, this august panel. Oh. There you go. Is that better?
Yep.
All right. So thank you. So I'm going to address this issue based upon my experience at the agency called DARPA, the Defense Advanced Research Projects Agency. So at DARPA, we like to look at these kinds of problems the way Director Arthur Prabhakar said. DARPA does science to build capability. It doesn't do science to do science, but to build capability. I like to look at it another way. When I was at the agency, we were looking ways to say yes. So if we have a serious problem at hand, how do we say yes to addressing these problems? So in the world of biodefense, and of course I am a retired Army officer, and I will tell you that it's the most chilling to me. Of all of the threats, it's the most chilling. I'll tell you why that is. Because biology does two things. It fights like hell to preserve self, and it fights like hell to preserve species. So if you turn something loose, it's going to fight like hell to survive and to sustain its progeny. This is a terrible thing. A nuclear attack is a one-time flash, but a bio thing can roll on and on and on and on. Look at Ebola. It's going to come back again, and it'll come back again, and it'll come back again. That is what biology does. So DARPA felt it was serious enough to start its own office, the Biological Technologies Office. And so we addressed the biodefense problem looking at it like this. There's going to be a threat. We have to identify it. We have to rapidly respond, and we have to sustain our response if we're going to win. So we had those 4 elements to it. And within those 4 elements, number 1 is obvious you want to prevent it. Number 2 is you want to diagnose it, the purpose of this particular panel. Number 3, you want to be able to treat it. And then number 4, beyond that, you actually have to sustain it. And that basically means is you've got to figure out a way to manufacture whatever the heck it is that you're using. And the second thing is you've got to make it through the regulatory pathway. That is a fact of life. You have to figure out how to do that. And DARPA actually addressed all of those elements. But let's focus now on the diagnostic, which is really what you wanted to talk about. So there is the goal of always identifying the virulent pathogen, whatever it may be, a bacteria or a virus or what the heck have you, so that you can appropriately respond. However, there's more than that. How can you first identify that there's a tsunami coming your way? What are those sentinel features in the ecosystem that is letting you know that there is a tsunami coming your way? The hurricane, as it were. And so one of the DARPA programs was called the Chikungunya Challenge. And that was, in fact, to look at those elements within the ecosystem that allow you to predict the spread of a pathogen while it's starting. That, in other words, it's starting in Thailand and it's working its way across Asia into Europe and then ultimately the United States. Is there a way? What are those sentinels? And so that was from the Chikungunya Challenge. The second one is, of course, in the diagnostic world, is do you have a box that ultimately when it gets here, that you have a way of doing these diagnostic testing? You had heard eloquently from the previous panels of the diagnostic laboratories that exist in the United States. They're in hospitals, they're business, and on it goes. They're really slow. They're not going to be at your port of entry. They're not going to be with your first responder, and they will be in your emergency department, but we've all been there, and 3 hours later, they're telling you you're having a heart attack. Well, thank you very much. Right? Where's the Undertaker? So what we have to have is a box that's right there. It is not the difficulty of the test, it turns out. What's the long pole in the tent? It's not the difficulty of the test. Immunochemistry is well worked out. Polymerase chain reactions is well worked out. It's the preparation of the specimen. You want to be able to spit into this machine and it tells you you're sick, like right away, or put a drop of blood, or put a drop of urine in there. It is that pre-processing that takes hours. And that's what DARPA is focused on in the ADEPT program, is to find ways to fast create ways to process that material so it can go directly into a machine, and that machine can then spit out your answer. It's the pre-processing. That's the long pole in the tent. That's what DARPA looks for, is what are the long poles in the tent. What about once you have somebody sick in front of you? What do you do? Well, a couple of things. Number one, if it's a virus, the best thing maybe is just to leave them the heck alone. Because as we all know, we've all ridden the subway, we all have children and grandchildren, and they sneeze on you. It doesn't mean you're going to get sick. So if you don't get sick, you don't worry about that person. The person you worry about is the person who's going to get sick and the person who's going to shed the virus, i.e. be a typhoid Mary and spread. Are there ways to detect this? And the answer is yes. The Prometheus program and the PhD program, which currently are ongoing, in fact, have already identified that they can actually do this. They can actually predict way in advance of expression of symptoms, shortly after exposure, that this person will get sick, but this one will not. They've both been exposed, but this one will get sick, this one will not. Furthermore, this one who's going to be sick, I can tell you when they're going to get sick, and I can also tell you when they're going to start shedding viruses, i.e. be a typhoid Mary, so we need to lock them up in their house. This is work done by Jeff Ginsburg down at Duke University, so he's not a bum, he's actually at Duke. So the UNC people, please don't know if I'm not sorry to offend you, but they've shown it, they've published it. Even better, they've shown that if you treat these people when you know they're going to get sick, they won't get sick. And you only have to treat them with a single day's dose, not 10 days doses. Why? Because the viral load is so low. So these are the benefits of during the early diagnosis. What you've done, understand what I said, by only having to treat for a 24-hour period rather than a 10-day period, you've just increased your supply of therapy by tenfold. That's what you've done. You've increased your supply, so logistically it has a benefit. So the diagnostics is definitely worth. So those three elements, the prediction of the ongoing tsunami, i.e. the Chikungunya challenge, the identify of the person who's going to get sick, and that's the one you need to concentrate on, that's the one you need to treat. The walking worried are now absolved and they can move on. That's the PhD program and the Prometheus program. And then the mobile analytic program which is the box that you ultimately need for your forward first providers. I don't want to discount the other elements that we had talked about. I know I don't want to take up too much of your time, we're a little bit behind, but I want to point out that the sustainment issue is a serious one because our peer adversaries, in fact, do control our supply of many of our medications. Tetracycline is not made in the United States. Cipro is not made in the United States. Those are two very important antibiotics that we use today to meet us. They're made elsewhere. Tetracycline, I mean, when I was a kid, admittedly, that was a long time ago, but when I was a kid, tetracycline cost about 6 cents a pill. 6 cents a pill on things. Go look today, right now, go Google it, and you'll find out a bottle of 500 tetracycline tablets, you can order it online, costs $1,800 a bottle. That gives you a flavor of what happens when our peer adversaries have control over our manufacturing capability. DARPA recognized us. We started the battlefield medicine program so that you can build a machine that can make medicines on demand. That's doing very well. We have two, one that will make the Cipro and tetracycline type medicines, and Biomod, which is will make the protein-based ones, such as a vaccine. The point is you want to bring that back and you want to distribute that. When there's a pandemic, the last thing you want is people driving all over the place trying to get there. You want to be able to walk to a Giant or walk to a firehouse and be able to get the medicines they need. And that's what this whole idea was about. This is something that we're doing with BARDA. God bless BARDA. BARDA is taking this and grabbing it, this problem by the horns, and are running down with it. And so I want to say again, these are elements too that we can't forget are really important elements to this whole response concept. So I'll stop here and I'll come back to where are some of the things that we need to go from here. One is transition. We had talked about it again and again and again. We have to find a sustainable model for this, whatever it may be, of any of these things, i.e. it has to either be by the government, that's possible, but even better will be a commercial market. And DARPA works hard to try to find commercial transition partners. Why is that? This is the size it is and not the bag phone that we all remember because it would made a commercial market. The U.S. Army was the only one making the bag phone. Guess what it would look like? It'd be the suitcase phone. So right now, it's this because of a commercial transition partner. We have to find ways to do that. That is not easy. That is hard. That is very hard. DARPA is great. I love DARPA. I mean, I'm a DARPA geek. I get it. I was there for 13 years. But DARPA has a very narrow mission focus. It just does. I mean, we have to do all the other stuff that DARPA does. The Biotechnology Office, which I was the founding director of, I'm really proud that this was an element of that portfolio. But really, this is a bigger problem than that. Our good friends at the ASPR, Bob Cadillac, his name is being used multiple times. He's a genius. Bob and BARDA have taken this on and they've actually created Drive. Drive is a DARPA-like element of BARDA. Thank God they're doing this. We need something like this. We need a group that can say yes. There's plenty of people we can say no to. Just go to the post office, you know? And so what we want at BARDA is actually BARDA needs to be resourced up for this. And so I'm going to campaign hard to try to get resourcing for BARDA to be resourced up. And then you would ask, should there be a DARPA-like activity within HHS? And I would argue there should be. You shouldn't have to depend on the Department of Defense to do these things. The HHS should be doing these things. So a DARPA-like model in the government, in HHS, small like DARPA is. DARPA is small. DARPA is as you know, a $2.5 billion agency. It's not a $38 billion agency, very small. But in the end of the day, small, lean, and mean, the ability to say yes and to attack these problems head on is really the way we're going to get there. We can talk about them till we're blue in the face, but the goal of America really is the innovation capacity that we have to find solutions. Thank you.
Here, here. Thank you. Governor, you want to start?
Oh, thanks. I gotta tell you, I was absolutely intrigued by this. You both referred one to a heart attack, one to this. About a year ago, I used this for self-diagnosis. I woke up one morning and I said, I'm not feeling very well. I wonder if I'm having a heart attack. So long story short, the whole notion of having a capability at your side is really is critical, and we're going to get there. I guess the point is, what's the quickest route to get there? Is it? Presumably do we need BARDA, good funding with BARDA? Do we need to create a market? we want private sector, we want commercial market to do it, but they're profit driven. So we have to create a market. So very interested in your perspectives as to what is the combination of both public and private and market related environment that would stimulate the kind of accelerated growth in the diagnostic technology you're talking about.
It's again a multifaceted response, but you're right that this will actually become a sort of the Siri of healthcare in its own way. We're already seeing an emergent field now of digital psychiatry, where much more accurate identification of categories of mental illness can now actually begin to be monitored in this way. Moving it into the infectious disease arena does require, as Dr. Ling said, that you've actually got to deal with at least a biological sample. Where you're dealing with agents that we know are common today, yes, you can develop, in fact, there are prototype units that function very well against those bugs which are with us all the time in emergency rooms. But once you begin to start talking about the exotics, and also having to scan a spectrum of them, then the technology is here to be leveraged, but it then becomes the economics of the incentive, because if I have a company, it's going to cost me $150 to $200 million to develop that multiplex test and to constantly update it. Not only have I got to have market pricing, which is sufficient for me to recover that, and if I'm a publicly traded company, by definition, I've got to make a profit too. But we're trapped already in a world of reimbursement, which Congressman Greenwood knows very well, where much of the modern diagnostics are still struggling for existence simply because they're not afforded the profit margin. Because essentially they're titrated back to the old style diagnostics that you have when you have your annual physical, your sodium, your potassium, your creatinine, so-called uni-analyte tests. But when you move to these very sophisticated multiplex tests, which as Dr. Ling said, you've also got to get a PMA approval in most instances from the FDA. That is a protracted, high-cost investment. And without the level of reward for investment, it's exactly the same situation that we faced with antibiotics. I was chairman of R&D at SmithKline, then the biggest producer of antibiotics in the world. And I have scars on my back trying to keep the antibiotic business alive, but I lost simply because there was no market. The market for antibiotics evaporated. It was clear, I made the statement in 1995, we will be facing massive antibiotic resistance problems circa 2015, because as Dr. Ling said, this is just nature's evolutionary cycle at work. So now we're hunting for new antibiotics, which with the fairest wind in our back will be with us 2018 to 2022. When those are here, we need to start thinking about the antibiotics of 2040, because we will have a resistance cycle that will repeat. But coming back to that, so market incentives eroded antibiotic R&D, hence why we're in the problems today with antibiotic resistance, and absent suitable commercial incentives to develop diagnostics. I made reference to oncology. That's a very rate limiting factor in the development of sophisticated molecular diagnostics in oncology today. In infectious disease, the problem's even greater.
It's really about risk. It's always about managing risk. And so we do have to engage the commercial private sector. That is absolutely true. The only way this is going to sustain, it can't be sustained purely on government. However, the government can help that transition into the private sector. And the way it does that, very simply, is reduces the risk of the upfront part. That we're trying to say is that when you develop any of these things, a diagnostic test, there's a development cost, we get it. But subsequent to that, there's also regulatory cost. And that is because the FDA has to do their very important work. We all celebrate what they do, but that comes with a cost. If you can reduce those front-end costs, it makes the transition much easier. And you reduce risk, of course, to the commercial entity that's going to take it on. It will get through FDA because the government's helping fund it going through that process. So that's why I say that for BARDA, which is trying to do all of this honestly on very, very little money, it would be very great if we could somehow support BARDA and the ASPR R&D budget up a little bit more. I'm not saying make them, $20 billion agency. I'm saying, they have $500 million, give them another 500. I mean, that's dust compared to some of the things we talk about. for something like this. And we don't have an equivalent of a DARPA at HHS. I think that we really should. I think that would be, something that would be, and remember, all of DOD, as big and monstrous as it is, DARPA is only a $2.5 billion agency compared to everything else that they do. But look at what they've achieved. And I'm just saying that this is kind of where we need to be, because it's the only way we're going to make it palatable for the commercial sector to take on. The commercial sector will sustain it. They'll carry it for the next 10 or 20 years. That's awesome. The government should not do that. That should be in the purview of the commercial sector. But we just have to make it so that they can carry it over, so the upfront risk and cost is reduced.
So,
If I may, Mr. Chairman, I
yes,
would just endorse what Dr. Ling said with regard to BARDA. It has been the one group that has been prepared to exhibit innovation in the diagnostic space and made requisite investments that in fact then bring and working with the private sector very effectively.
So and neither of you think that we need to alter BARDA. In other words, that the basic BARDA model is a good model. It just needs to be better funded. Is that right?
So they just started something called Drive, which is their new element. That is their innovation their innovation unit. They actually stood that up in only 90 days. It just shows you that under the leadership of Rick Bright and Bob Cadillac, what they're capable of doing. So I would say right now, give them their chance. They're trying to do it on nickels and dimes that they're scraping together from that they're finding. But honestly, just give them their chance.
For far too long, they were not allowed to undertake some of the most fundamental research, which is needed to move in this translational sequence. And not only Drive, but another initiative that they've created called CARB-X, which relates to antibiotic resistance, again reflects forward thinking and a recognition of the challenges of commercialization.
Dr. Ling, in the work that you did at the Biological Technologies Office for BARDA, DARPA, sorry, I was going to ask, were you able to interest the commercial entities in taking that work and translate it?
Oh, yeah.
Yeah.
Yes, sir, Senator. So a lot of the things on the ADEPT, for example, that program that I talked about, more in the therapeutic side, they had a relationship with GSK and Novartis to take some of the things forward. The mobile analytical platform, there was efforts to get Abbott. Abbott actually was going to take it on. To my understanding, though, Abbott has not continued forward, but they actually assumed control over it from that little company. So we got Abbott. The nice thing that the government can do is make those introductions, make these marriages, because a lot of times the big companies don't know where they are. But in some cases, they're going to be direct spin-outs. The one long sustained genomic vaccine that came out of this whole effort has started out as a stand-up by itself company called DNARX. The Hedges platform is a one-shot lifelong immunity kind of thing, and based upon non-viral. That's the key point. That's another long pole in the tent, right? Is using a virus to introduce genomic material. You get sick as a dog. So this is a non-viral approach, and that spun out, and it's kind of on its own. So it is, there's ability to both transition it center to large companies, such as the Abbotts of the world, the GSKs, and also to spin it out as a small stand-up company. Remember, Facebook started as a couple of guys in the basement of Harvard.
I saw a movie about that.
Yeah, I did too. Yeah. It was a good one.
It was a good one. So what about the problem that Dr. Post mentioned that we've wrestled with, which is how do you create incentives in the private sector to produce medical countermeasures or diagnostics for which there may not be a market unless there's a crisis?
That's always a problem. DOD has that same problem, Senator, as you know. So DOD, when we were at DARPA, so the other part of DARPA that's building weapon-based systems, for example, there's really no commercial market for it, at least certainly not an ethical commercial market for it. So how do you sustain those markets? It does exist, for example, I'll give you a clear. So for example, manufacturing technology, the Mantech office, right, underwrites the creation of the brick and mortar necessary to build certain elements of the industry. And then second, they also look for ways that the government can also help underwrite it as being a customer, for example, of certain pieces of this equipment, not other than the missile itself, some elements of the missile, for example. For example, the lens. The lens, as you know, is really important on the JDAM bomb, but I mean, we don't use too many of those. So how do you sustain that business? And so, of course, they underwrote them to develop those to become lenses for lighting fixtures. So in essence, there are ways to do this. We have to just be a little bit more innovative in our thinking. We do have a model that exists. We do have existent legislation that allows it. It's just a matter of policy that's kind of blocking us right now. And policy is hard. Legislative changes are really hard. I don't have to tell you guys that. You know better than anybody. So since the regulations exist to allow this to happen, we just have to be a little bit more agile in terms of applying them and be a little bit more flexible in allowing BARDA and these other folks to do their job within the law, but perhaps a different interpretation of it.
And as we heard at a recent presentation of the panel on the new smallpox vaccine, guarantee purchase agreements are absolutely essential if you're going to be engaging in something for which there's no civilian market. And as we heard in the smallpox example, it cannot be held hostage to the annual budget cycle. Otherwise, your investors are not going to support the engagement in those sorts of activities. So guaranteed purchase and guaranteed sustainability of funding for the projected R&D cycle are absolutely essential.
Tom?
Well, that was actually going to be my question, Dr. Ling. Dr. Post just said it, I think. How could you just clarify your view of the importance of multi-year funding to ensure that market?
Oh, no, I couldn't be more supportive of what Dr. Post just said, and the point of multi-year funding. That these year-in, year-out cycles are really very disruptive to anybody who's doing early R&D and ultimately to the sustainment model. I mentioned to you manufacturing technology a moment ago. That's out of the OSD of the DoD. That actually has, as you know, that money has no year to it. That's actually money that was legislated by the Congress, and it was money that actually has no timeline to it. So when a company gets manufacturing technology dollars, i.e. man-tech dollars, to build their brick and mortar, that dollar does not expire. That's incredibly helpful for them as they build out their business model and, in fact, build out the sustainability of their business model and takes away that upfront risk. Once they know they have those dollars and investors know they have those dollars, you've taken away a lot of risk from those people and they're able to do the build-out. So, man-tech does exist, so evidently there is legal precedents to do this, and we should take advantage of that.
And just to be even more clear, when we say multi-year funding, how would you define multi-year?
In the cycles that we're in, they're 4-year cycles.
4? Is that sufficient?
At least 4.
At least 4. And again, I think for diagnostics, 4 should be enough. But in therapeutics, it is possibly a more extended cycle. But if you as it would be if you were in industry, you would say, here is the project. We've approved it on the basis of claimed technical feasibility with a projected duration of X. And then you add to that what you think should be the time for regulatory review, and that should be the cycle. So for certain products, it could be 2 years plus regulatory time. For others, 4 years plus regulatory time. In the therapeutic cycle and vaccine cycle, it may have to be longer.
But the point that I was trying to make, Senator, is that if, I as a government contract officer and I put money against this line, if it doesn't expire, if it doesn't have a sense to it, I could literally put 4 years worth of funding against that line and then say, look, it doesn't expire at the end of 1 year. Because we do have to abide by the cycle of the federal budget. Totally get it. But that's the way you could do it without having to disrupt the whole idea of the yearly cycle of the federal budget. You can put money in there, it won't expire,
right,
a la manufacturing technology dollars do. And that way you don't have to create new legislation at all.
Right. Well, we do it we've done it before. We can certainly do it here. Yeah. Could I just go back to the conversation just a moment ago on the comparison between BARDA and DARPA? I've always looked at DARPA as sort of one of the best examples of what research can do with a government sponsorship and just the extraordinary efforts. And I congratulate you, Dr. Ling, on the amazing work done there. But you said that today BARDA still has a number of impediments that keep it from becoming a DARPA. Could you just be more specific with regard to what those impediments are and what we'd have to do to make BARDA a DARPA in the same realm that it is today?
Yeah, certainly. There's really only two things that I would say. Number one is philosophy, and the second one is budget.
Philosophy.
Philosophy. DARPA goes in with the attitude that at DARPA, you'll like this. We ask, first question, whenever somebody wants to do something I always ask, is it cool? If it's not cool, don't do it. I don't care how important it is, it's got to be cool. All right? An invisible airplane, that's cool. We should do that. Definitely do that. The stealth technology, right? In my world, a brain-controlled robot. That's pretty cool, all right? So that was, of course, the prosthetics program. But the point if that's a very different philosophy, because that's a question of asking, what do you want? What do you really want? Not what is possible and not what's probable, but what is it that you want? Right? So that's the first. So it's a different philosophy. And then the second part is, if it's cool, then by golly, say yes. Find some way, come hell or high water, to say yes. Because any fool can say no. Right? I mean, that's the easiest thing. No, saying no basically absolves you from doing anything. No, let's go home. All right? But yes is hard. You've actually got to figure out now how you're going to do it. So that is DARPA's philosophical attitude, is how do you say yes? And we struggle a lot to say yes. Other federal agencies don't share that same philosophy. Look, we're all feds here. We get it. But the point is that's the very first step. BARDA, to their credit, is doing that transition. They're pivoting towards that. They do have a lot of legacy things they have to deal with. I get it. But DRIVE, to me, is an example of where they're trying to pick out a section and say, we are willing to take the risk. We're willing to find the cool, and we're willing to find the way to say yes. That's what DRIVE is. But DRIVE's second big problem is they have limited dollars. They're trying to take on biodefense. I mean, this is not a little problem, right? I mean, so with that big problem, they need an adequate amount of resourcing to go take the risk. Because when you take risk is really when you're going to push the boundaries, but you have to accept that you're going to fail sometimes. And you don't fail because you're stupid, and you don't fail because you're lazy. You fail because the science is hard, and that's okay. That should be okay. If you don't swing for the fence, you're not going to be the home run hitter.
But is it even possible to say yes with such limited resources today?
No, that's just it. So, I mean, they're dealing with $20 million. I mean, they had to carve this out of they're not a wealthy agency by any stretch of the means, right? And they have this big problem they're trying to attack. I mean, Bob Cadillac is a genius, but he's not a magician. I mean, it'd be great. It'd be great if he was, Harry Potter and could, ding, and there we go. But that's not going to work that way. So, got to give him the resources. I mean, Bob Cadillac and Rick Bright, just give them the resources. And if you believe that they're going to squander it or silly, then why did you employ them? Right? I mean, first things first. If we really believe they're as wonderful as they are, doing the job there, then we should adequately resource them. That's one thing DARPA does. Pick the brilliant people and resource them. Because the best way to damn somebody to failure is to resource them. So I would argue, seriously, and I'm sitting in front of you, and I will say in open forum that I believe that the BARDA, the ASPR R&D budget should be doubled. Absolutely. I think it would be an incredible good spending of money. It's not a huge sum of money relative to the things we do. It's not $1 billion. It's under $1 billion. But what they could achieve with that would be what we're talking about, Senator.
Well, Dr. Ling, I just wish you had a little more energy. I mean,
But I think adding to what's already been said, there has been a turf and rice bowl issue that BARDA has had to face, namely the belief that the front end of innovation is only going to come from NIH and that they only pick it up after that's occurred. They're now getting into the early stage, which is where they need to be, because that's where the true innovation is going to come. And they may have to ask for forgiveness, even with an expanded budget. But the bottom line is the fact that, somewhat provocatively, NIH has not been the source of innovation in this particular field.
well, thank you both.
Thank you, Tom. Jim?
So should I assume then that DARPA's working on maglev skateboards? They're very cool.
Something closer.
A closed session, we'll talk about that. So we talked about some of the challenges to in bringing forth the new diagnostics, reimbursement challenges, scientific challenges. Talk about the regulatory challenges, because George, you talked about, could be $100 million, $200 million costs, and as we know from the drug developments, and most of that's spent in clinical trials, and I'm interested. I probably should know more about this than I do, but how do you demonstrate efficacy in front of the FDA for surge diagnostics and and diagnostics where you have you can't use placebo, you got very low incidence of, in terms of the patient population. Are there things that we should be thinking about in terms of reforms in the regulatory regime?
No, I think it's often very easy to pick on the FDA, but I think certainly with Commissioner Gottlieb's flexibility, I'm less concerned about the issue of the regulatory framework. Excuse me. As you know, there are two categories, the so-called 510K and then the full pre-market authorization. The types of tests we're talking about are undoubtedly going to have to go to a full PMA. The challenges, I think, are going to be both for the industry and for the regulators is the fact that those tests are going to have to be constantly updated. So if you've got V1, V2, Vn, you're going to have to go back through the whole process again for V2, V3, Vn. I think we're seeing much more flexibility from the agency to accept that the V1 was the predicate, as it's called, and then these are refinements. You've got to demonstrate scientific validity, but you're not going to have to go back through the whole process. The other complexity that lurks is that many of these are also as much not about just the test itself in terms of its technical validity, in terms of sensitivity and specificity. It's also going to be increasingly linked with software. So you're going to have a duality of the actual test itself coupled with the computational capacities that go with that test. And so I think that the agency is starting to wrestle with that one, which of course goes well beyond infectious disease, because as Governor Ridge said, so many elements now of digital therapeutics where you're linking a decision based upon information. So the agency, I think, is spending a lot of time intellectually to deal with that. But so I'm less worried about this constraint from the regulatory standpoint.
Ken? Thank you, Jim.
Just briefly, Dr. Ling, I was intrigued by your comments about the ability to predict who's going to get infected. And if you could, in layman's terms, recognizing I took the same science class as Senator Lieberman,
Yeah.
what are you referring to there?
Yeah, so thank you, sir. What I'm referring to is that illness begins at the cell level. And then when enough cells get sick, the body starts to fail. I think that's the easiest way to put it. So is there a way to measure early on that these cells are starting to fail before the body does? And if you can determine that these cells are starting to fail, that means that you have many days before a large number of those cells fell, enough that you were actually getting sick or something. And so that's in fact how the Duke guys pivoted on that. They was really very ingenious. What they did is they said, okay, if cells are failing, the body's obviously going to try to fix it. They're obviously going to try to fix it. If they're successful in fixing it, you're good. If you're unsuccessful at fixing it, in other words, the body's chosen incorrectly on how to respond to this thing, and the body therefore will fail, and i.e. get sick. So there should be two pathways that can be delineated by doing these early measurements. And in fact, that's how they did it. And this is in the open literature, and they actually showed that they could do this. They had to go to England, by the way, to test this. You'll like this. The way they tested, they went to England, and they got a virus, H1N1 Brisbane, and they actually squirted it into people's noses. This is the truth. And so only in English would allow you to do this, I think. And so, and squirted in people's noses, and then they followed them, and they found that some didn't get sick, and some did get sick, and that's how they were able to identify these markers. And these markers are great because man is, only been on Earth about 50,000 years, and viruses have been around for like billions. The response is actually very, very homogeneous, from you to me to Dr. Post. Our bodies respond the same way to viruses and differently to bacteria. And in fact, we respond very differently to one type of virus versus another. So this approach that the Duke guys had figured out is in fact really remarkable. And you can see the applications. And this is where we come back for viruses, obviously, that they'll tell you that, oh, these people are getting sick and they're getting sick from this, and they're going to, and this is how they need to respond. But also you could conceivably use that for things like cancer and heart disease and the like. So it's really, this approach toward biodefense has so many other potential applications too. So that's why I'm a little less worried about the commercialization if we can get them over the hump.
So I will plead the fifth in terms of squirting stuff up at people's nostrils, but this issue of the fact that, by the time we begin to feel a little achy, you could use a different S word, when you're starting to feel ill, your body is already starting to send out signals with things like called lymphokines and cytokines at least 48 hours ahead of that. There are now sensitive assays for detecting at least 60 of those in the bloodstreams. As Dr. Ling said, it's also very important to be able to differentiate between viruses and bacteria so that you're not then just dispensing antibiotics like candy for viral diseases when it's going to not be of any value. Our colleagues in large-scale animal agriculture are far ahead of us in this regard, insofar as this is not exactly the most palatable version, but the large chicken farms actually have robots that go up and down the line doing a thermal scan on animals, and if there is any abnormality, the robot grabs the chicken, and I won't tell you about the rest, but the robot grabs the chicken. Our friends in the cattle industry have collars that measure whether an animal is eating, the frequency of eating, mobility, so they're actually able to identify an ill animal long before, because the economics of the herd are the issue at hand. So whether it be overt sensors on the outside or these biochemical molecular markers out of blood or saliva, these are very active areas of research. And as Dr. Ling said, this goes well beyond infectious disease. It enables you to pick up a number of other diseases in the pre-symptomatic state.
Dr. Ling, earlier you said it would be great if HHS had DARPA type. Yeah. So would that be in place of BARDA?
Oh, no, sir.
No.
When I say that it would be great if HHS had a DARPA-like,
Yeah.
I mean, if you think about all the other problems that we face today, autism, pancreatic cancer,
Right.
on it goes. I mean, this would be great because when I was at DARPA, all these people would come and they would say that these are horrible things. A pancreatic cancer, it's a terrible thing, right? We haven't, or glioblastoma multiforme, GBM,
Yeah.
right? No significant improvement over the last 50 years. And wouldn't it be great if DARPA could take this on? It'd be awesome if DARPA could take this on, but DARPA is just this big of an agency. So a HARPA or a DARPA Health or whatever you want to call it would be great.
Yeah.
However, biodefense is a serious problem. It should be, it should have its own focus. It should have it should have its own place. And I think that BARDA has the mission for it. BARDA's ready to take on that mission. They've already proven themselves.
Good.
And I would say that also alleviates this health DARPA from having to do that and can focus on things like autism and pancreatic cancer and GBMs. Thank
you. I want to follow on Tom's question about your energy level. Could you give us your diet?
Sorry.
This reminds me, Bob Dole used to say in the Senate about Strom Thurmond, who was then, 96, that he followed Strom around all day, and he did whatever Strom did. If Strom had a banana, Dole had a banana. So, and God bless him, he's still with us. 95. Right. All right, you've been both of you have been great. We're proud George's member of the family. That how you're cool.
Thank you.
You may not be a robot, but you're cool.
That's right.
Any other questions? No. Okay, we'll go to the last panel now. Powers that be, ladies. Should we have a short break? Should we skip the break? What do you want to do? 5 minutes. All right, Asha, you're the boss. We'll be back at 2:30.
But yeah, Bob's he's not.
No. Ah, there we go. Thank you. Okay, this is it's been a very productive, informative day, and again, I thank everybody. This is our last panel, a great panel on intelligence and information sharing. We have Kathleen Riley, who's U.S. Navy retired, senior professional staff at the Select Committee on Intelligence of the Senate, and former professional staff of the Permanent Select Committee on Intelligence in the House side. Duncan McGill, PhD, Lieutenant Colonel, U.S. Army, retired, Dean of a suspiciously named educational institution. The Ridge College of Intelligence Studies and Applied Sciences at Mercyhurst University. It's a great tribute and totally deserved, obviously, by Governor Ridge, and quite consistent with his public service that this exists. And then Dr. Kerr, PhD, Director of Pandemics and Emerging Threats Office of Global Affairs at the Department of HHS. So we're really delighted to have you here. We have a good solid hour, maybe a little bit more. And Ms. Riley, let's begin with you.
Is this on? No. Thank you very much for having us. I think I speak for my fellow panelists that this is an important issue and something that the country needs to address. I'm Kathleen Riley from the Senate Intelligence Committee staff. In my oversight responsibilities that were passed on to me a year ago when I took the seat from Dr. Bob Kadlec, was, you now have the mantle for bio and biosecurity. The unfortunate piece about this is that intelligence lives in the dark corners of the world, where we look at things as how the enemy can attack us. What are our vulnerabilities? What are our susceptibilities? And how can we defend against those? How can we ensure that the American people and our allies are prepared for something that could be weaponized, or an issue where a foreign adversary would like to introduce a vulnerability into our ecosystem that could cause great harm. So in the National Blueprint for Biodefense, the Blue Ribbon Study Panel, there was recommendation number 6 and recommendation number 16, which Dr. George has asked me to address. So recommendation 6 really talks about how to really focus biodefense in the intelligence community. Now, the head of the intelligence community, the DNI, right now, as we were talking earlier with Senator Lieberman and Senator Daschle, is part of the WMD group. So it's really, it's a sub-project inside the WMD group. And it really needs to be brought out into the light. It needs to be focused, as before we were talking about in the prior panel, about focusing biodefense. But in the intelligence community, to focus it, quote, left of boom, to quote my DOD colleagues, what are our vulnerabilities? What are our susceptibilities? And what are our adversaries' intent? And then what is the government's duty to warn? So recognizing this issue as an intelligence security issue, national security issue that's vital to our national security interests is paramount, and identifying pinning the rose on someone's lapel to take responsibility and as an executive agency, and what those missions and roles may be. The recommendation number 6 recommends that the DNI appoint a Nimh to centralize bio issues. And there's some further study that's being done right now. Dr. Bob Kadlec is looking at this, and his counterparts inside of the Director of National Intelligence are also looking at this. The Nimh would have to look at issues that are, before the attack. What are our abilities to protect against an attack? And then what the intelligence community's response would be, and what their roles and responsibilities would be to an attack. Raising it to the level that it's a discrete and focused area, that not only biodefense begins at home with things like, the cigarette pack warning that says the Surgeon General says that smoking kills. Well, what happens to your DNA when you send it away to 23andMe and Ancestry.com? Where does it go? What is the government's duty to warn where DNA leaves our shores. A whole of government approach is absolutely necessary, but unfortunately, as some of the senators on the committee would say, a whole of government means none of government. So really understanding who the executive agency is and where those missions and roles and responsibilities are in the intelligence community and beyond the intelligence community and who they're responsible to is absolutely necessary, outlining those and making sure that you have a policeman with a carrot and a stick to make sure everyone is doing their job. I'm also a cattle rancher on the weekends. I have a herd, a small herd up in Pennsylvania, and my husband lives up there full time, and I go and see him part time. But looking at cattle and looking at birds and the health of our livestock is also very interesting, because those things can cross over into humans. And it's one area where the intelligence community really isn't looking. So it's one area that where I think we can pull on and really understand how that human and animal interaction happens. It's not something that the Department of Defense is really looking at, and it's unfortunately not something that the intelligence community is looking at. So I was listening to Dr. Post's remarks, and I think he's spot on. It's something we really need to look at. Avian flu, for example. Treating the bio threat and our biodefense as a critical national security infrastructure issue is absolutely necessary, both in the intelligence community and beyond the intelligence community. Local law enforcement, how do you respond? What's your duty to warn? How do police officers, what are the police officers' vulnerabilities going to be? New York City Police Department, for example, if anthrax were to break out and they couldn't respond, how would we as the intelligence community have a duty to warn the rest of the community? Recommendation 16 talks a little bit more about how do we ready our forces that are to respond. Again, the intelligence community, where is the duty to warn throughout the first responders and the hospitals and pharmaceutical companies and those that would have to react? What is the mission and role of the intelligence community, and how do we share that information? Sometimes information that is considered very close hold, pharmaceutical companies and specific recipes and cocktails that they have for their medicines, how do we protect those? One of the areas in the National Biodefense Strategy, there were 5 specific goals with recommendations in each one of the goals. The intelligence community really only addresses goals 1, 2, and 3. And there was a common thread between all 3 of these goals that talks about risk. What preventative measures do we need to take in advance, and how do we measure risk? So it's a good question, and it's been brought up in the previous panel. Both Dr. Ling and Dr. Post talked about preventative measures. The cowler, for example, which is the device that the cows wear that tell you when your herd is sick so you don't pass from one cow to the next cow. Avian flu, for example, how do you know what strain of avian flu you have, and how do you share that with local law enforcement? What is the risk that we have in our vulnerabilities as an American people to certain strains? For example, if the collection of DNA in the United States of America that is running rampant for 23andMe and Ancestry.com and some other companies that do DNA analysis, people's most interesting subject is themselves. So everyone is very interested in where they came from and who they are. And we're probably the most diverse community in the world here in the United States of America, and that's a wonderful advantage that we have, but it also induces a risk. So what are the risks of having such a diverse community? Can a foreign adversary pinpoint and target a specific group of people in the United States and get them sick or hurt them in some way that maybe we can't really talk about here? Zinc fingers and CRISPR-Cas9 using gene editing tools, genome sequencing labs that are being bought up by foreign governments, that there's only very few genome sequencing labs left in the United States that are owned by Americans. What kind of a risk does that induce into our American enterprise? Missions and roles. again, addressing risk, missions and roles. You sit and count up how many people have responsibility and how many people are, quote, doing bio. And it's the list I have right now is 27 different people. So how are they communicating with each other? Do they have a common place? Is there a app for that? Is there a cloud infrastructure or a place where you can sandbox theories and ideas collectively, but protected environment so that some of those outcomes aren't known to our adversaries? The role for the intelligence community is a hard one to address, and both the chairman and the vice chairman of the Senate Intelligence Committee are always amazed at how much biodefense and biointelligence and genomics are involved in everything that we do every day. The problem is it does involve itself in every aspect of the intelligence community spectrum. So how do we bring focus to all of these areas, everything from missiles to makeup, everything that happens in the intelligence community? How do we bring this all together and focus it? The recommendation in the Blue Ribbon Study Panel says appoint a Nimh, pin the rose on someone's lapel and make them responsible. And this is an area that we're going to look into very, very seriously on the Senate Intel Committee. Thank you.
Thank you. That was very helpful. We have questions, I'm sure. Dr. Dean McGill, thanks for being here.
Thank you so much. Good afternoon, Senator Lieberman, Governor Ridge, and distinguished members of the Blue Ribbon Study Panel on Biodefense. It's an honor and a privilege to address you this afternoon on the topic of intelligence and information sharing in the complex, multidisciplinary environment of biodefense. For 35 years, I've been engaged in the complexities of weapons of mass destruction, first as a nuclear weapons maintainer in our Army, before moving on to explosive ordnance disposal and eventually countering proliferation. And in the last 13 years, educating others on the study of threats while in the National Intelligence University and now as Dean of the Ridge College of Intelligence Studies and Applied Sciences at Mercyhurst. During my journey, I found that the United States has two primary existential threats concerning technology. First, and the one we are most prepared to see, study, and understand are nuclear weapons, with the massive destructive capability and long-lasting residual effects. Complicating response to these incidents is the disruption and removal of our infrastructure for responding to them. The second, and the reason for today's discussion, are biological threats. Although not complicated by the impact from destruction of existing infrastructure, biological threats complicate response because of their impact on those that use the infrastructure, and in cases of replicating bacteria and viruses, the capability to extend their reach beyond the point of origin. Biological threats can occur from nature, which principally I believe the health community is well focused, as we've heard much today. My focus has been on one of man-caused events surrounding bioweapons. The National Blueprint for Biodefense and National Biodefense Strategy are important steps in moving forward towards a comprehensive program. Intelligence into biological weapons is a complex, multivariable problem that cannot be understood solely by understanding disease. The medical side of this problem is reactive in nature. To be proactive and prepared to understand or counter the myriad biological threats requires understanding the system of systems that they comprise. The systems include our research science, engineering, management, production, storage and logistics, weapons design and development, education and doctrine of use, policy, financial activities, as well as medical preparation and response. As we move forward with the implementation of the National Biodefense Strategy, I believe the key to understanding these system of systems is integration of the disciplines into a task-organized team to better understand what we know, as well as where our intelligence gaps are. The gaps may be in knowledge about the science or knowledge about the intelligence targets. In all cases, the intersection of technology with humans is what interests me. What matters is who and how the technology will be used for nefarious purpose. By task organizing our team, we understand how to map the threats across the system. We can identify intelligence gaps and better understand how to prioritize limited resources into collection and analysis programs within the intelligence community. However, I believe the critical outcome of bringing together the disciplines is increased intellectual diversity. And we know that in both medicine and intelligence, increasing our intellectual diversity spurs increased creativity. By integrating our expertise, we allow better understanding and communication across the disciplinary boundaries. Couple that with the fact that today, more and more discoveries occur on the overlap of the Venn diagrams of two disciplines begs for an integrated systems approach to studying the biodefense problem. Let me give one small example about which I sometimes ask my students to consider. Today, one of the highly promising areas for treating bacterial infections, correcting genetic problems such as cystic fibrosis, hemophilia, or sickle cell diseases, producing biofuels, creating bacteriophages to eliminate malaria-carrying mosquitoes, is CRISPR-Cas9. The enzyme allows much easier gene editing. Researchers can easily alter DNA sequences and modify gene function. CRISPR is generating extreme excitement in the scientific community because it's faster, cheaper, more accurate, and more efficient than other existing genome editing tools. The decreasing cost of entry into this science area increases the amount of research that can be completed, but it also makes more difficult the understanding of where the work is occurring, who is doing it, and for what purpose. Potentially, the disease-fighting benefits of CRISPR are incredible, but there's a threat side to this tool. Unethical governments or organizations may use the techniques to synthesize viruses, allowing the targeting of specific ethnicities with disease or enhancing their genetic traits, as well as the potential for affecting germline stem cells, creating targeted harm or enhancements that are generational. Overlap CRISPR's Venn diagram with the focus on the future advances in artificial intelligence, and you may see a future with the potential for computer-driven design and virtual testing of genetic editing that may eliminate the need for laboratory testing until prototyping. The computer can drive the research based on programming from man and the lessons it learns as it moves through the programming. The disciplines required to study the extent of this problem are not fungible. Moreover, they are not fungible across the other WMD paradigms. We need a centrally coordinated capability to map, plan, prioritize, and finance the collection, analysis, and reporting on biodefense-related systems. Thus, assuming the appropriate priority and resourcing, a national intelligence manager for biological threats would have the ability to create that interdisciplinary team within the framework of a discrete intelligence topic while addressing bystanders and distributing assessments necessary for the enterprise. In addition, one of the components within the organization could be dedicated to intelligence sharing to all levels of our governmental structures with needed intelligence information. Thank you very much.
Thank you. Thanks for your comments on the proposal for a national intelligence manager for biological threats. Needless to say, we're interested. Dr. Kerr, thanks for being here. You've had a lot of very relevant experience to biodefense, so we're grateful for your testimony now.
Mr. Chairman and distinguished panel members, it is indeed an honor to be with you, and I really appreciate this opportunity to share my thoughts with you in seeking to advance our nation's biodefense intelligence efforts. I will state up front that my comments are my own views and with the experiences that I share, and do not reflect the position of the U.S. government departments at which I have worked or currently work. You asked the panelists to address the Blue Ribbon Panel's recommendations 6 and 16 to improve the management of the biological intelligence enterprise. It is with incredible remorse that I would posit there is no biological intelligence enterprise anymore. Your report notes that in 2005, the Rob Silverman Commission on the Intelligence Capabilities of the United States regarding weapons of mass destruction described in detail the failings and weaknesses of the intelligence community regarding biological threats. In Chapter 13, their report, they recommended that the newly created Director of National Intelligence, or DNI, quote, create a deputy within the National Counterproliferation Center, NCPC, who is specifically responsible for biological weapons to ensure the implementation of a comprehensive counter-biological weapons strategy and collections initiative, unquote. In August of 2006, I departed the White House Homeland Security Council's Biodefense Directorate to join ODNI and NCPC as the Deputy Director for Countering Biological Threats, and immediately initiated a review of the IC's policies and programs devoted to countering biothreats. Together with the IC's leadership, we produced the first National Intelligence Strategy for Countering Biological Threats in 2007 to set the vision, goals, objectives, and milestones for the collection, analytic, and science and technology disciplines across the IC agencies. I worked closely with one of the most creative intelligence senior officers in the CIA, who had initiated and managed the Counter-BW program, hence referred to as CBW, where C stands for counter, not chem, since its initial funding in 2002 with full implementation in 2004. Together, we produced and budgeted a budget that mapped the strategy's implementation plan, and with the DNI's Chief Financial Officer, the Office of Management and Budget, the National Security Council, and the Congressional Intel Committees, Congress appropriated a budget in FY 2008 that more than quadrupled the Counter-BW program's 2006 baseline to fund the new and enhanced efforts called out in the strategy. These actions address the Blue Ribbon Panel's recommendations 6A. In less than a year after the strategy's implementation, we had initiated several of the other recommendations from the WMD Commission's report, including the establishment of the Biological Sciences Experts Group, or BSEG, in February of 2007. The BSEG was a cadre of approximately 65 TSSCI-cleared non-U.S. government, public health, life scientists, veterinarians, physicians, psychologists, and law enforcement disciplines, just to name a few, who dedicated and provided advice and counsel on relevant to the IC's collection, analytic, and S&T disciplines. The BSEG physically met 6 times per year, and members were available to the IC for specific consultations outside of those meetings. Annual evaluations of the BSEG's utility to the IC components demonstrated success in bringing outside expertise into the IC's mission. These actions address the Blue Panel's recommendation 6B. As the enhanced efforts at collection and analysis bore fruit, we worked with the National Security Council in 2009 to establish the Senior Executive Biointelligence Briefing Series, or CBIBS, a monthly meeting of Assistant Secretary level and above individuals from over 19 departments and agencies devoted to countering biological threats. Seniors from multiple agencies from the Departments of Health and Human Services, including ASPR, NIH, CDC, FDA, Departments of Agriculture, Defense, State, and Commerce, to name a few, were briefed at the TSSCI level and above by analysts from the IC on counterproliferation, counterterrorism, and counterintelligence biological threats. This forum provided a direct exchange by which the consumers of biological threat information could ask questions of the analysts, exchange views on the intelligence based upon their department's mission with fellow seniors, and analysts could better appreciate the perspectives of their products' readers. These actions address the Blue Ribbon Panel's recommendation 6D. Implementation of the strategy was also having an impact on intelligence collection against BW. Prior to the implementation of the strategy, BW intelligence collection was a priority only in name. Significantly greater efforts were being put into other intelligence topics due to a variety of reasons, including the comparative difficulty of collection against BW, the greater interests of senior policymakers on other topics, and the inertia of long-standing collection platforms focused on non-BW issues. The strategy enabled this to change. The funding from the Counter-BW program enabled novel collection platforms. This, combined with more regular requests for information on BW issues from seniors across departments and agencies, raised the profile of BW intelligence collection, more effectively incentivizing the intelligence cycle and the collection agencies to leverage their finite resources against these difficult topics. By 2011, the strategy was being implemented, milestones were being met, and we decided to update the strategy in 2011 version to refine objectives and advance targeting efforts. I would state that at that time, progress was being made, and we had hope. Unfortunately, a confluence of circumstances beginning in 2013 started to bring down the enterprise we were trying to build. In April 2013, I was returned to the White House on the National Security Council Preparedness Directorate to address the novel strain of influenza that was circulating in China. Later that year, the CIA's Counter-BW program manager retired after a long and distinguished career. And little did we know that at that time, in FY 2014, the entire budget that we had worked so hard to acquire would be swept into other projects within the CIA. By the beginning of 2015, the Counter BW program would be at a budget level equal to when it was implemented in 2004. What did this mean? This meant that innovative collection methods came to a grinding halt. Analytic production on BW targets across the CP, CT, CI, and health security disciplines plummeted and has remained at all-time lows. Multi-sectoral and IC non-Title 50 collaborations were terminated. Programs to link non-U.S. government multidisciplinary experts with the IC officers, such as Biochem 2020 and BSEG, became in name only. The CBEBS Forum last met in late 2015. And at the same time, a decision by the Defense Intelligence Agency to enact a 50% reduction in force, a 50% reduction in budget to the National Center for Medical Intelligence irreparably diminished the capabilities of the only IC entity devoted to medical intelligence. The U.S. government has never recovered from the damage dealt to the Counter BW program from FY 2014 onward. Thus is the defense that I offer you for my open hypothesis that there is virtually no biodefense intelligence enterprise anymore. If I could offer one closing comment or call to action, while noting that any new effort will effectively be starting from scratch once again, we did it once. We have a blueprint for success, and we have painful lessons learned for how to develop an effective Counter BW intelligence enterprise. But this time it must be sustained with leadership empowered with authority and resources commensurate to this gravest of threats. Thank you for this opportunity, and I will try to address any questions that you have.
Dr. Kurt, thanks very much for telling us that story. That is not only very helpful, but it's very provocative, and hopefully together we can respond. I wonder if we should start where we normally end the questions and ask Ken if he'd like to begin. Also, just want to make sure you're paying attention.
Just make sure I'm awake. Yeah, I'm after Dr. Ling, I'm going to be awake for 3 days. So I just want to just start off where you ended up. You said you have a blueprint. Has anybody, let's assume that we can marshal the forces to try to re-energize that effort. Looking back at what you did, have you done an after action thinking, next time we do it differently? We have some lessons learned here?
We certainly have.
Share those with us either today or in the future if we're going to make recommendations along these lines?
Absolutely happy to. You can't imagine how this has haunted several of us who helped that, because personally, I take it as a failure. Anything that is established that does not sustain or is not sustained by a person, I always thought, if I get hit by a bus, it should live on. The fact that this was so easily destroyed simply by moving the budget was shocking to all of us. And that is why the argument for creating an entity that has both the authority and the budget. I will say, we tried 3 times to create a Nimh, and 3 times we were told no. The variety of reasons. One, we were told that you'd have to have a Nimh for nuclear, you'd have to have a Nimh for missile, you'd have to have a Nimh for chem. It did not equal. We were told the second time that basically S&T covered the issue. The third time we were told that there are 12 NIMHs, there cannot be a 13th. So there are many other lessons that could be shared in non-open forums.
Okay. We'll follow up with you on those.
Jim?
Well, the question I was going to ask was how you analyzed the motivations for the deconstruction, but based on your past answer, I assume that not to be told here. Is that right? I mean, what's your analysis of why this fell apart and why it was? I mean, it's hard to believe it was malintent. So it was what was the driving force?
I agree with you completely. My answer would be neglect. When you looked at the I served under.
Transition administrations, right? So this change of administrations. Is that what happened?
No, actually in 2013, 2014, it wasn't. So no, it actually came, so for example, the directors under which I served in NCPC cared deeply about each one of the issues that were under counterproliferation. So having someone not only who was, your strong advocate to the DNI, but to the external face of the entire community was incredibly powerful. That changed in later years. And the thing that I think that came as the greatest surprise was that when we had fought so hard for the budget and that the budget was being managed out of the program and there was a phenomenal working relationship where DNI, we set the policy and standards, and then the program was actually administered across the community through a central effort, that worked, but only as long as those entities were in place. I think all of us were surprised by how easily the budget, which was not fenced, became poached. And basically in a single budget year, it just was swept away. So.
It's a pretty sobering assessment, Dr. Kerr. Thank you very much for it. Dr. Miguel, in your testimony, you talked about the optimum biodefense intelligence analyst would be a product of a system of systems. I mean, if you really wanted it at all. And I guess I'm just kind of curious as to how we build out that capacity, because we talk about you need to understand the threat, you need to understand the actors, you need to understand the science. I mean, there's so much, but there's no school that gives you that multiple disciplinary system of systems integration. So what's the foundation for it? Intelligence analysis?
So
is it science? What is it?
Yes, Governor. I think the key is the analyst. The analyst is the hub. The experts come from the disciplines. The analyst has the ability to translate that information that comes from the disciplinary experts and brings the disciplinary experts together to talk about where the threat areas are. But there's no single discipline that's going to understand the other's discipline, as you actually talked about. What you have to do is bring the folks together and have them work as a team to map out the system, to figure out within this discipline area, where are our gaps? Are they science gaps or are they intelligence gaps on a target? And then you can, from that, using the analysts, using their structured analytical techniques and designs for building out ability to seek information, go out and find it. One of the big areas that is coming out today that we need an analyst is data science. Everything that we're teaching now at Mercyhurst is about teaching the analyst to understand data, use tools to process information, determine what the variables are, find out where you collect information on the variables, and eventually be able to analyze that information to get some bit of risk that you can give to a decision maker for decision, so they can understand the risk and understand where to apply resources, because we're always limited on resources.
Well, obviously, I'm very familiar with the work you do. I'm just kind of curious, as a matter of course instruction, do you embed any bioterrorism tabletops, any bioterrorism scenarios into your education, either undergraduate or graduate level? As a tool?
Yes, at the undergraduate and graduate level, we have courses in WMD, but they're treated as a triumvirate. They're not individually focused.
I'm very familiar with many of your graduates who either work for alphabet agencies or the private sector. Get a job as soon as you leave. Well done. My inquiry, thank you for referring to this. We're very proud of the document. Obviously, you and your colleagues on the panel have read it. The sobering narrative we got from Dr. Kerr and your testimony, do you care to offer an opinion as to why, since this has been widely distributed, widely read, highly praised, the White House is all over it, we got a strategy, is there an inertia in the DNI to move in this direction? Are they opposed? It's an opinion. Are they opposed to it? Do they think they have it covered? I mean, from your perspective, if you care to share that opinion, What do you think of it? What's going on there?
Well, the director for Biodefense Strategy at the DNI is a GS-15 level position, and it is vacant.
Say again?
It's vacant. It's a vacant position. So I think that, Governor, your assessment is right. It has to do with what Dr. Kerr, I'll just say Dr. Kerr did a great job talking about what happened a few years ago. It's leadership. It's having a champion for biodefense and biointelligence at the DNI level. Separating biointelligence and biodefense out from WMD, from the chemical, biological, radiological, and nuclear disciplines is very difficult because, as you say, as Dr. Kerr so aptly put it, then you have to have a Nimh for nuclear and a Nimh for chem and a Nimh for, bio is different. It has a different impact to our people. It has a different way of addressing the solution. It is multidisciplinary. It involves universities, think tanks. It involves cattlemen. It involves the Department of Agriculture. It involves pharmaceutical companies. It involves our allies, and anyone who can put that all together and lead from the front. From the Director of National Intelligence has got to be a super incredible person. And unfortunately, that champion retired.
We got to pay a visit.
To the DNI. Is that what you mean? Pay a visit to the DNI. It's a good idea. Another former senator, Senator Daschle.
Well, thank you, each of you, for your fantastic insights and testimony. I guess I would just like to ask, as we end this day and think about the role of the Blue Ribbon Study Panel and our hope that we could be catalytic in finding that leadership, what advice you'd have for us? How can we help you? How can we help elevate? How can we help find ways with which to create more opportunities for meaningful leadership and direction and implementation of this plan? What is it we're not doing, or what is it you'd like to see us do more of in order to do what we all want to see happen in this country? I'd like to ask each of you if you could give me your answer to that question.
Senator Daschle, I think it's an interesting question. The intelligence community responds to leaders. It responds to questions from leaders, decision makers. So the priorities that are established across the community are a function of what leaders want information on and where they perceive the risk to be. So if we can articulate the message of what the real threat is in terms of disease and fighting disease, but also the impact of those things that are man-caused, whether it's an accident or on purpose. We have to be prepared for that. And if we can articulate the threat to a level that gets the leadership to ask the questions, the money will follow and the work will occur. I mean, that's the way the community works, I think.
Thank you very much, Dr. Miguel. Dr. Kerr?
Thank you, because that's actually a great setup. The intelligence cycle is driven by senior leadership asking questions. And so, the entire basis of basically the pyramid starts with the most senior people asking the questions. And those might be the difficult questions. We often talk about that, when we were sitting in the NSC, you could ask a question in the intelligence community. If they have the answer, they had one of the most robust mechanisms of gathering the information, putting it together, synthesizing it, and returning it to the customer. If they didn't, depending on where you fell in that seniority, the collection apparatus was activated in order to go get those questions. And so, that entire process by your panel making the recommendations that there needs to be improvements in that entire cycle to basically re-energize it again with the resources to be able to answer the questions has been very powerful to date. And so it's now, again, reminding the senior leadership that this is a real and present imminent threat. And that's something that I don't think people who live outside of the community think about day in and day out.
Thank you. Thank you very much. Ms. Whalen?
I would say one of the things that the Blue Ribbon Study Panel talks about throughout all of its recommendations is public awareness. The leadership piece of this is paramount in all of these recommendations, and obvious by the panel that we have assembled here. There's an incredible interest in this, but public awareness and making our leaders understand what that threat is, as Dr. Kerr was saying, understanding what that threat is and how it can harm us. What is the duty to warn? What is the government's mission and role, the duty to warn our critical infrastructure? For example, the H1N7 virus, World Health Organization, I think it has a 40% death rate. The World Health Organization, the agreement is that if you have solutions or studies that you are responsible for identifying those solutions and studies and telling the other members of the World Health Organization. And what if one of those countries has a solution, has a remedy for H1N7 and refuses to share it? Introducing a vulnerability globally, protecting their people, but no one else. The duty to warn, the public awareness that this is a real threat to the United States. And what are we doing about it? Where's the leadership? How do we make it an enterprise again? A community looking for a solution. And this panel is very important. My recommendation or my personal opinion would be I offer that doing some more time and spending some shoe leather on Capitol Hill and making folks aware so that our people know.
Thank you. Thank you all.
So let me pick up on that and ask to what extent the biological threat, from your observation, seems to be on the minds of the members of the Intel committee that you serve.
So the members of the Senate Intelligence Committee have had a number of briefings behind closed doors.
Yeah.
And some of the members walk away quite scared. They're very concerned about where we are with our ability to react to a biological threat, and that we know where those threats are coming from, and that we know what the vulnerabilities are of our people. They're also very concerned about the amount of attention that's being spent and the amount of money that's directed towards solution. So,
In other words, not enough.
not enough.
Right.
And also, the missions and roles aren't clearly defined. Their leaders, the leaders in the intelligence community now, of course, this problem extends well beyond the intelligence community, but the intelligence community's job is to understand the threat, understand our vulnerabilities, and guard against them, make those recommendations to guard against them for the defense piece, right? DoD defense piece, DHS defense piece. And there's intelligence elements in every single one of these enterprise members, but it's not an enterprise, as Dr. Kerr put it. It's a community,
Yeah.
but it's not an enterprise. So how do we have better leadership? How do we understand out beyond the intelligence community, beyond those members of the intelligence community? What is our duty to warn? What is the mission and role of the intelligence community? And then how do we share that data so that it's protected? Because it's really sensitive stuff. How do we protect it? But how do we share it at the same time?
Right. So, except for an occasional, a novel that scares people about the biological threat, it's on people's minds. And of course, it was during the anthrax in 2001, Senator Daschle was a target of. And now, every now and then, when something regarding ricin comes up, people do get a bit nervous about it. The poisoning of the former Russian agent in England got people's attention. It was quite different. It was targeted and all that, but it got people's attention. On the question of the infectious disease pandemic, the country was in a state, almost a frozen state for a while about Ebola, and it was really quite confined. And thank God not much happened, but people are frightened by that. And of course, when you think about what happened in 1918, As we said earlier today, that there's good reason for that. So there is public concern out there. The question is how to take this threat and make it a priority for the leaders so they get ready for it. Because as I said to Tim Morrison earlier in the day, a lot of the work that's being done on this is invisible to almost every other American until that day comes, God forbid, when there is a biological attack or there is a genuine outbreak of infectious disease. Then the entire country and world will be focused on it, and a lot of fingers will be pointed if we're not ready. I mean, and that's actually how we got to our, as I recall it, our recommendation for a national intelligence manager for biological threats, which is if you think about how do you defend against the threat, it's like any other defense effort, and this one particularly, you need good intelligence. And as we studied the field, it seemed to us that in this part of it was like most everything else we were seeing. There was actually some work going on, and some of it focused on biological threats, some of it coincidental to intelligence work that was being done, for instance, on the terrorist threat. So you might come across something that suggested that this terrorist group was beginning to get interested in perhaps committing resources to developing biological weapons. But there was no coordination, and there was not a real awareness across the intelligence community of how much money was being spent or where it was being spent. So in some ways consistent at a more targeted level with the suggestion that we made that government-wide, this all report up to a leader. And that in our case of our report, the vice president, we said we recommended a national intelligence manager for biological threats in the office of the director of national intelligence to do two things generally. One was to coordinate the biological intelligence activities going on. Perhaps in some ways, part of the coordination would be to say, well, we're not doing enough over here. So, and then the second, as part of it, was to both coordinate the expenditure of money, but then, if necessary, advocate for more money. So, I think I've heard the drift of what you've all said, but I'm curious as to whether I'm curious about the attitude, the opinion you have about this idea of a national intelligence manager for biological threats. Is it a good idea? Is it the way to answer some of the problems you've described and we've described? Ms. Riley, do you want to start?
I think it's a good idea. I think we got to put some meat on the bones on what the NIMH's qualifications would be, and then what that NIMH's outreach would be to the rest of the community which it serves, right? So this isn't just an intel problem. Right. This is also a reaction problem. The Department of Agriculture, Health and Human Services, which doesn't even have an intelligence arm. They're thinking about it, but they don't even have one. Universities, how does this NIMH, how does this person reach out to the rest of the community? Because all of those solutions aren't in the intelligence community. They're out there. They're in the pharmaceutical companies. They're in the universities. Duncan brought up the importance of good analytics, big data. Google, Amazon, bring them in too. But that person is going to be able to reach out into the entire community. Intelligence is a supporting role, right? It supports. You don't have a Secretary of Intelligence. It's a supporting role to every single one of the departments, bureaus, and agencies in the U.S. government. So, preventative measures, as you brought up, Mr. Weinstein, this is very important. And understanding what those preventative measures are, without being a Chicken Little and saying the sky is falling and everybody's going to die of anthrax, or Ebola, but have a resolute, mature, and very sober approach to what biodefense really is and what could really harm us. That NIMH is critical. Having that central point inside the intelligence community is critical, but that person has got to be able to reach outside the intelligence community. So should they reside inside the executive office of the president? Should they be in the director of national intelligence? Where that position is something that maybe we should chat about.
Okay, that's great. Dean McGill, how do you feel about the idea?
So if it's properly resourced and properly led, we have the leadership that wants that.
Right.
Then it makes perfect sense because the Nimh allows you to develop your discrete intelligence topic and allows you to appropriate the resources and requirements across the various components within the community. What's interesting today are there are a number of bioactivities in the community. They exist everywhere. The problem is they're
In the
discrete.
intelligence
In the
community,
intelligence
right.
community, but they're discrete. They're
Right.
serving a specific purpose for a specific customer. They're not being coordinated. Somebody has to coordinate that to make it effectively a discrete intelligence topic. And that's where you have to go in the end, I think. But it takes the leader to ask the question.
Sure.
You have to have the question.
Dr. Kerr?
I would agree with everything that has been said thus far. And in the current Office of the Director of National Intelligence structure, the authorities resident in the Nimh are the capabilities that are required in terms of being able to mobilize, coordinate, and communicate between the collection, analytic, and S&T capabilities. I could not agree more, though, that in terms of any other discipline that I can think of over which currently the NIMS have dominion, bio is the one where even the United States government does not have the wealth of expertise that is required to completely assess both risk and threat. The intelligence community is responsible for that threat component. And so having someone who is able to marshal the capabilities, assets, and resources of the intelligence community while being able to leverage the outside expertise is absolutely critical.
Okay, that's great. You know, Governor Rich said maybe we should go see Dan Coates, our friend at the DNI, which is, I think, a good idea. And then maybe we should go and see our friends on Senate Intel. This can be done by order of the DNI, but I don't think we need legislation. But maybe we'll come away
Let it
from.
be written, so let it be done. That would be good.
Exactly, that's enough. But if
right.
maybe Dan Coates would like it to be in legislation, then we'll come and see. Is there an Intel authorization bill? Chris, do you do it every year?
Yes, sir.
You do, right?
Yes, sir.
Yeah. Okay. Well, we might come and see you. Okay. This has been a great panel, really.
Great day.
Yeah, and a great day. Thank you, Mr. Chairman.
Mr. Chairman?
Final any comments? Yes, George.
Yes, I'd like to build on something that Ms. Riley raised, where it's another example of a sleep at the switch. This issue of foreign access to genetic information on people in this country. Apart from the security of the databases, whether it be in healthcare or 23andMe and Ancestry.com, the following obviously is an unclassified comment. All this information is available in the public literature, and that is the question of a Chinese company called iCarbonX. iCarbonX is a consortium of $600 million invested in it by individuals who have known association with the Chinese government and the PLA. The head of that consortium is a very gifted geneticist who actually built the Beijing Genome Institute, which is the largest genome sequencing capability in the world. The colloquialism is if it moves, they'll sequence it. So that's everything from microorganisms to us. But they have invested in buying up a number of companies, all of which are related to either profiling the antibodies which are present in the bloodstream of Americans, or the technology for measuring those antibodies in the bloodstream of Americans. But most important, quite remarkably, and in my opinion, unethically, Patients Like Me, which was an altruistic foundation where individuals with rare genetic diseases donated their genetic information for the purposes of advancing medical research. iCarbonX paid Patients Like Me $100 million for access to the records on 600,000 Americans with rare genetic disorders. And I would submit that that is only the tip of the iceberg relative to a very purposeful campaign on the part of the Chinese to actually gain access to the comprehensive genetic information of the American population.
Well, that'll keep us up tonight.
Cheery way to end up.
Yeah. Yes, Dr. Koresh. Thanks, George. That's really riveting. I hadn't thought about where that information goes. They now have information on my wife, who went to one of
We're
those.
creating our own vulnerabilities.
Pardon?
We're creating our own vulnerabilities.
Yeah, yeah.
Yeah, and
Really?
actually, my question just aligned with Dr. Post on that same thing, and I do want to first thank you for being honest and sharing this information. The panels have gotten better and better all day long. Well, that was not meant to be disparaging, but they've all been great. But thank you, and Chief Rowley, thanks for sharing your adenovirus with us too. And mentioning cows and chickens, that's always a great thing, because this group certainly wants to pull that together. So, and I think, we're talking a lot about catching up now. We're talking about a lot of catch up here, but I want to kind of move us a little forward thinking, and just as Dr. Post was saying, last week I was at Bill and Melinda Gates Foundation, Grand Challenges, and they paid for 1,200 scientists to come in and announced a big initiative with the Chan Zuckerberg Center, which is out at UC San Francisco, offering money and a free genetic sequencer to everybody who wants one, as long as you share all your genetic findings on microbes and humans from around the world with them, and they'll do the analysis for free, and they'll store all the data for free. And when asked what the business model, they said, oh, it's just for human well-being and goodness, just like Facebook is to make friends, that business model. And so that's going forward. I mean, CRISPR-Cas9 is, now we're years old and we're trying to deal with that. So my question to you is, what's our forward thinking on some of this bioinformatics as a bio threat, really, is I think where we're going on this. So what should we be
Again,
doing
it's
there?
public awareness. It's the second and third order effects of things like this that affect our population. So you can buy a gene editing tool on the internet for like $90 now. So you can do it at home in your kitchen. Modify genes in mice or a plant or whatever you like. That's pretty scary, isn't it? The fact that, folks are so, they'll go to a hospital and, they'll have blood drawn and there's a little box at the bottom, very fine print that says, would you like your DNA shared with, for research, for medical research? And everyone checks that block and nobody has any idea where their DNA is going. And, in the intelligence community, we talk about obfuscation of data. How do you obfuscate DNA? It's Mrs. Fields' recipes to her cookies. I mean, you can't obfuscate it. It is your DNA. So you can extract a name, but you're still going to be able to find out who that person is. Everyone is unique. There's no way to obfuscate it. Everyone is unique. So as we introduce these vulnerabilities, just interest in our own well-beings and our naive, I'll say naive, interest in medical research and checking blocks. And yes, of course, and I fell for it too. My father was at Johns Hopkins and he had leukemia and he was dying and I would do anything to save him. Anything. Cut off my arms and legs, whatever, just save him. Checking blocks all over the place. Use my DNA for whatever you want. I fell for it too, but I didn't know. So the public awareness piece of it, how do we prevent that? How do we protect our human data? How do we understand, put the warning on the side of the cigarettes? Warning, Surgeon General has determined that the Chinese could get access to all of your genetic makeup and start editing the entire American population. Big fear.
That's the next bipartisan study panel that will be created. Other final, Governor Ridge, or anybody else on the?
Scooter.
Yes, Scooter, Libby.
Thank you all for your testimony. I'd like to make one during the Cold War, we spent a lot of intelligence community efforts to avoid strategic surprise. We thought we knew pretty much what the Soviet nuclear arsenal was. To a lesser extent, we thought we knew something. If what we knew about the Soviet nuclear arsenal was a 10. Scale of 1 to 10, what's our ability to rank strategic surprise from the country's type of technology? I'm told it wasn't functioning.
Sir, I'd say it's probably,
That's the chairman editing me out, which is
No, that was the Russian embassy editing you.
the interesting piece to this puzzle is when you start looking at the difference between nuclear weapons and bioweapons, it has to do a lot with the way you look for your keys in the parking lot at night when you lose them. Where do we all look? We look under the lights because we can see it. So we can see the nuclear threat. We can measure it. We can define it. It's measurable. The bio threat is much, much more complicated because of the dual use nature and the differences in the dual use in nuclear weapons. There's a physical difference. There gets to be physics that can determine whether it's this or that. It's much more difficult in bioweapons because you don't know when you're doing editing, is that for nefarious purpose or not? And it's much, much smaller. It's much easier to hide. It's much easier to produce even in an industrial scale, let alone in a laboratory scale. So I'd have to say, if I had to give you a number, 1 or 2.
Always right.
I mean,
Dr. Kerr, you agree?
I had actually answered your question with a 1 or 2 as well. For all the reasons given, the signature, for me, one of the fundamental differences is that when you look at intent, motivation, and commitment, and by that I mean that you have, intent is fleeting. Today, I intend to do something. Tomorrow, after talking with you all, I may intend to do something else. Commitment is when I'm actually committing resources. In other words, I've established a laboratory, I have bought reagents, I have gathered a pathogen. If I'm a scientist bearing an intent, wishing to carry something out, and the ability to actually make that pathogen, I am the delivery of that biological weapon. It's not the same for a nuclear physics reaction. So everyone who knew going into my office, they were never allowed to say it's too hard, because that's almost a given for our issue. But when you look at breaking down the individual components to try and dissect them and what is it that the intelligence community can bring to bear on each of those, it becomes a more tractable problem that you can actually design platforms that address specific aspects to it. So I would still put it the way you phrased your question at, though, a 1 or 2 compared to the nuclear issue.
Biological strategic surprise. So President Xi and President Putin look at strategy in many, many years out. President Xi is 300 years out. Putin is, obviously, you can leapfrog leadership in Russia, but the strategic outlook is, 100 years. In the United States, our strategic outlook is the next quarterly earnings statement. So we have a hard time with strategy. We can dismantle or birth things within a few years, and our ability to hold them, champion, and lead them is challenged. Intent, motivation, and commitment. President Xi's One Belt, One Road initiative, or RBI as it's now, Road and Belt initiative, identifies how the Chinese are taking a page out of the United States playbook, and they're having a global footprint. Everywhere where we're not looking, they're moving in. And this might be a place where we're not looking and they're moving in. I would put it at a 1 or 2.
Okay, well, it's always good to end a meeting knowing that there's a lot yet to do. Anyway, I thank this panel very much, and I thank all of you who have been interested enough in this subject and this threat, really, to stick with us all day. We'll be back in a month or so. Thank you very much. Go safely.